Brooklyn Independent Television.
Most women don't want to become pregnant until they're ready and able to care for a baby. Abstinence, of course, is one approach, but there are also quite a few forms of birth control available. Healthbeat Sherry Caravan went to Brooklyn Women's Services to survey the methods they offer, including a relatively new form of permanent birth control.
From oral contraceptive pills and injections to intrauterine devices or IUDs and condoms, those looking for temporary or reversible birth control have a lot to choose from. But what about women who want a more permanent option? As Brooklyn Women's Services obstetrician and gynecologist Dr. Ronald Burka explains, many of them choose to undergo a tubal ligation.
So this brochure shows the
You can think of it in terms of two groups, those who get their tubes tied after delivery, and then there's those who come in that are not pregnant or not recently pregnant and have their tubes tied. This is sometimes referred to as interval sterilization, or between or after a pregnancy. The postpartum tubal ligation, typically made with an incision underneath the belly button. Tying your tubes otherwise would require, usually done through laparoscopy, where you make an incision in the belly button, place a laparoscope, and then cauterize or block the tubes that way. Same-day surgery in most cases.
But some women may not realize there are permanent techniques that can be done right in a doctor's office without making incisions.
Since you had the procedure, how's it been going?
Fitting's been great.
Not long ago, 35-year-old Bensonhurst mother Tracy Mondry opted for such an alternative, choosing the Essure system.
Okay. Any heavy bleeding, fever, anything like that going on?
Just light staining, nothing out of the ordinary. I decided it's enough. I have 3 beautiful girls, looking for a future now for college. With the economy so bad, I felt that it's the right time to do the procedure. So I'm able to take care of my 3 and save up for college and give them all their needs as they grow up.
Essure was first approved for use in the U.S. in 2002 and has become more popular in recent years. Unlike more traditional permanent procedures, it usually does not require general anesthesia and takes less than a half an hour to perform.
Basically, an Essure is performed transcervically. So you would access the opening to the fallopian tubes through the cervix with a scope in the uterus, identify the opening to the fallopian tubes, and then the Essure device basically introduces a coil that goes into the tube opening and causes scarring and eventually blocks the tube.
Very simple, very effective, and it results in permanent sterilization.
How long does it take for Essure to be effective?
It takes about 3 months. What happens is the coil device initiates an inflammatory response or scarring where it's implanted in the tube. And so over the course of about 3 months, the tube should be completely blocked with its own natural scar tissue that has formed as a result of the coil.
During that time, patients are advised to use other methods of birth control until a test can be done to verify they can no longer get pregnant.
I have to go back in January to have that one test done to clear that it's closed.
How did you learn about this?
With the doctor, we discussed different methods, and I decided to go with this particular procedure.
How do you feel about having the procedure?
Actually, I'm happy I had it. I actually decided to go with the right method instead of having surgical, because I'm a chicken.
Are there any other permanent forms of birth control that can be done in the office like Essure?
There are actually 2 devices on the market which accomplish the same thing and can be done in the office. The first, as I described, is Essure. The second is known as Adiana. Again, very easily performed in the office with local anesthesia and well tolerated. It takes about 3 months to cause a permanent blockage, and again considered permanent birth control.
Despite the convenience and high level of effectiveness of both Essure and Adiana, doctors advise patients to discuss all the options with their partners before making any decision about permanent birth control.
Younger patients do have a higher incidence of regret in terms of, 10 years later you might wish to still have another baby or have changed your mind. And like any form of permanent contraception, the patient would need either a reversal or IVF. So first and foremost, with any permanent procedure, you have to make sure that the patient is certain that she no longer wants children.
In the case of this Bensonhurst mother, she says she has no regrets.
So we'll see you back in a few months.
Yes.
Have a great holiday.
Would you recommend it to other people?
Yes, I would. Yes, for sure.
Why?
Non-surgical. That's, no one wants to get put under. I feel it's more of a health risk. The procedure was very quick. It was very comfortable. And within 20 minutes, I was done. I went home. I drove home. I was with my children.
Take care, doctor. Thank you.
All right, bye-bye.
This is Sherry Carabin reporting for Healthbeat Brooklyn.
Download this program's podcast on iTunes. Keywords Brooklyn Independent Television.